Karnataka has reported its biggest single-day spike with over 50,000 new COVID infections and 346 deaths. Bengaluru alone accounts for nearly half of the total surge after it reported 23,106 new cases and 161 deaths on Wednesday. The surge comes even after the state is under strict restrictions to curb the continuous rise in COVID cases. Chief Minister B.S. Yediyurappa had earlier said that the curbs already in place will continue for now. The state is under a strict close down till 12th of May with a 6-hour daily window. Yediyurappa also said that a decision on the extension of the current restrictions or a complete lockdown is going to be taken at a later stage. Amidst the pandemic, there are people who are trying to take undue advantage of this situation. In Bengaluru, one such incident has come to the fore. Officials of Bengaluru's civic body, the BBMP, have been caught taking bribes for the allotment of hospital beds that are reserved for COVID patients. Here's a disturbing report.
The mad scramble for beds. A spate of oxygen-related tragedies. And a sharp, relentless spike in COVID cases is making Karnataka the emerging epicenter of India's second wave. And amidst the festering catastrophe, a sickening possible reason for the shortage of beds. Officials at Bengaluru's civic body, the BBMP, have been caught taking bribes for allotment of hospital beds reserved for COVID-19 patients, leading to hundreds of COVID patients stuck without beds in the state capital. A full-fledged COVID bed scam. Let's tell you how this terrifying reality was uncovered. The Yediyurappa government recently set up a war room in BBMP zones, which citizens can call to get bed allotment without delay. However, since the last 15 days, anyone who called the BBMP war room for beds was told there was simply no beds available, including oxygen and ICU beds. Tipped off about the bribery operation, BJP MP Tejasvi Surya and a team of BJP MLAs rushed to South BBMP war room to take stock. They say that they found BBMP officials in nexus with outside agents collecting bribes to allot beds reserved under the government quota for COVID-19 patients.
It has been allotted at the first instance to a person who is asymptomatic and is under home isolation. And in the 12 hours that he has from the time of allotment to the time of admission, if he does not get himself admitted, the bed becomes auto-unblocked. Like that, there are 4,000 instances, which means 4,000 beds were unnecessarily blocked in the name of people who did not want the bed.
Here's the modus operandi of this entire scam. Citizens calling for beds are immediately told no beds are available. Then, in some instances, a bribe is demanded for allotment of beds under a so-called government quota. A bed is then blocked in the system for 12 hours, during which the deal is negotiated and done with the desperate patient. If the deal doesn't go through, the bed is back in circulation for the next bribe attempt.
Now, in one instance, 12 beds were booked in different hospitals at different times under a single asymptomatic patient's name. Well, the current rate for one single bed is upwards of 40,000 rupees, and it's even more if you want an ICU bed. The Bengaluru police, as of now, has arrested 2 persons. They are questioning several others after registering a case.
Tejasvi Surya has also dialed former Infosys chief Nandan Nilekani for help in scam-proofing the BBMP's bed allocation software.
The Chief Minister has immediately called and he has said that he is going to take all these officers who are involved in this to task. This has been brought to the notice of the Honorable Chief Minister. The Honorable Chief Minister will take appropriate action.
In a city where soaring numbers and citizens suffering on a daily basis, the scam has triggered anger and a political crossfire.
ಒಂದು ನಮ್ಮ ಪಕ್ಷದ ಸಂಘಟನೆಗೂ ಮುಜುಗರಾಗಿದೆ, ಎರಡನೇದು ನಮ್ಮ ಸರ್ಕಾರಕ್ಕೂ ಮುಜುಗರಾಗಿದೆ. ಮುಖ್ಯಮಂತ್ರಿಗಳು ಯುನಿವರ್ಸಿಟಿಯಲ್ಲಿ ಮಾಡುವಂಥದ್ದೆಲ್ಲವೂ ಮಾಡ್ತಾರೆ. ಆದರೆ ಆರೋಗ್ಯ ಸಚಿವರು ನೀವು 2 ಖಾತೆ ಬೇಕಂತ ಹೇಳ್ಕೊಡ್ತೇವೆ. 2 ಖಾತೆ ಯಾಕಕ್ಕೋಸ್ಕರ? ಒಂದು ಮೆಡಿಕಲ್ ಎಜುಕೇಷನ್ ನಿಮಗೆ ಬೇಕು, ಹೆಲ್ತ್ ನಿಮಗೆ ಬೇಕು, ಹಂಗೆ ನಿಮ್ಮ ಜವಾಬ್ದಾರಿ ಏನು? ನಾನು ಹೇಳಕ್ಕೆ ಇಚ್ಛೆ ಪಡ್ತೀನಿ, ಇವತ್ತು ಕೆಲಸಗಳನ್ನು ನಿರ್ವಹಿಸಕ್ಕಾಗಲ್ಲ, ರಾಜೀನಾಮೆ ಕೊಟ್ಟು ನಾನು ಬೇರೆ ನನಗೆ ದುರಾಸೆ ಇಲ್ಲ, ನಾನು ಮಂತ್ರಿ ಆಗಬೇಕಂತಲೂ ಖಂಡಿತ.
The scandal has stunned a suffering city. If such criminality could be happening in a well-administered metropolis, imagine how bad it is elsewhere. With Nagarjun Dwarkanath in Bengaluru, Bureau Report, India.
Even before we learn to combat the much contagious and deadly COVID second wave, experts and politicians suggest that India should gear up to prepare for other waves. Principal Scientific Advisor to Centre Vijay Raghavan yesterday said the third wave is inevitable. However, the time scale of its occurrence could not be ascertained. He further said that the studies are being conducted at the moment to understand and anticipate COVID variants and emphasize on making vaccines more effective to fight the virus variants. Meanwhile, Maharashtra Chief Minister Uddhav Thackeray said there is a need to prepare for the third wave and the efforts to fight the virus are already being made with the help of doctors that are present in the state.
A phase 3 is inevitable, given the high levels of circulating virus. But it's not clear on what time scale this phase 3 will occur. Hopefully, incrementally, but we should prepare for new waves.
सरकारच्या विज्ञान विषयक सल्लागारांनी एक इशारा दिलेला आहे की देशामध्ये तिसरी लाट येते आहे, सावध राहा. सावध राहा म्हणजे काय करायचं? तर नवीन काही नाही आहे त्याच गोष्टी.
As more and more people are getting the infection in the country, with India's R rate or reproductive rate at about 1.44, questions are now being raised now about whether we are now arriving at herd immunity or not. So what are we? Are we a country with herd immunity? Experts are weighing in.
Swathes of the Indian population, young and old, are down with COVID-19.
आप कुछ करिए ऐसा कि जिंदगी बच जाए या फिर खत्म कर दिया जहर देकर इंजेक्शन। जो हमारी माताएं बहनें जितनी एडमिट हैं उनको इंजेक्शन दिलवा दीजिए, मर जाए।
The exposure to the infection to SARS-CoV-2 is at an all-time high, with the reproductive rate at a shocking 1.44% of the population, which means one infected patient is infecting 1.5 people. But are we headed towards herd immunity? And what is herd immunity to begin with? Herd immunity is achieved when a high enough proportion of the population is vaccinated against a disease or has been infected with the disease and developed antibodies against it. Any one infected person will have the opportunity to infect less than one other susceptible person, hence halting the spread. Sero surveys or antibody surveys in India across cities have shown a high exposure to infection. But experts believe that is not really translating to herd immunity. Delhi, for example, had shown extreme exposure to COVID-19. At levels safe to say the population was reaching herd immunity. But that wasn't the case.
We are seeing some people who are having infection again, who had got infection last year also. So it has to be looked at very carefully. I would say sero surveillance data are helpful, but they cannot really guide treatment to a large extent, because if we said the sero survey in Delhi showed that more than 50 to 60% people had already got infection, then that data would suggest that we are already achieving herd immunity, and we should not have seen so many cases in Delhi. So I think we need to be very careful how we interpret sero survey data.
In fact, the last sero survey done in India showed that more than 21% of India's adult population had been exposed to COVID-19. The Indian Council of Medical Research noted that 21.4% of more than 28,000 people surveyed above the age of 18 showed exposure to the virus. But it also said that a large part of the population is still vulnerable to COVID-19. This means we are still far from herd immunity.
Immunity is an elusive concept as of now because most countries are seeing multiple waves. Some of them are even seeing fourth wave. What we need to ensure is we have battle-ready workforce that can immediately mount a response whenever there is a wave affecting the country. Also, we need to ensure that vaccination is the only weapon to ensure most people are protected rather than assuming that people will attain herd immunity through the infection.
Worse, the virus is changing its form, and this makes experts feel that there should be no reliance on herd immunity from widespread infection.
The virus is changing its face. There are a number of mutants which are circulating, which are increasing, which may evade immunity. And so, again I say, because of all these things, it's very difficult to achieve herd immunity in India, and this virus is going to simmer for a long period of time with intermittent exacerbation from time to time.
Sero surveys and antibody surveys and reliance on these to gauge if a population has reached herd immunity is a flawed model, is what many medical experts are now saying. There are cases of reinfection as well. So what do we really have before us? What we have is the vaccination, and what we also have is adherence to COVID-appropriate behavior, which is going to keep us safe, at least to some extent. In New Delhi, Sneha Mordani for India Today.
The Supreme Court wraps center amidst the ongoing oxygen crisis in Delhi. The court asked Modi government to ensure smooth supply of oxygen in the national capital. The apex court also directed centre to present a comprehensive plan by tomorrow on how they're planning to facilitate the supply. This is coming in as the situation continues to remain grim in Delhi hospitals, while the state and centre are busy playing the blame game.
It's an abandoned city, its people sitting on a pyre counting their dead. Most dead, not due to the virus, but lack of oxygen. The city-state, headed by the Chief Minister Arvind Kejriwal, and the centre, headed by the Prime Minister Narendra Modi, continue to shift blame in the fight over oxygen. Coming to the rescue of a gasping Delhi has been the judiciary, the Delhi High Court, and now the Supreme Court. You can put your head into the sand like an ostrich. We will not. The High Court taunted the centre on the 4th of May, while asking the central government to show cause as to why contempt of court should not be initiated for non-compliance of orders passed with respect to the supply of oxygen to the national capital. The centre moved Supreme Court against the contempt warning. The apex court during the hearing did say contempt does not solve the crisis, but tore into the centre for not providing enough oxygen that the city needed to stay alive. A bench of Justice D.Y. Chandrachud and M.R. Shah recommended that the centre take note from the Mumbai model of the BMC to try and ensure oxygen supplies to Delhi. It also refused to stop the High Court from monitoring the oxygen situation. We direct that by 10:30 a.m. tomorrow, the centre shall place a comprehensive plan in the form of a chart, indicating the manner in which the direction for allocation of 700 metric tons shall be complied with, adding that it was answerable to the citizens of Delhi. Now, the administration has let citizens down. The judiciary, of late, has been standing up, scheduling urgent hearings, seeking immediate replies, counting each breath of gasping citizens of this capital.
It is an India Today impact. Delhi government has now taken cognizance of India Today mega ambulance expose that revealed how few ambulance drivers were duping hapless families by charging them exuberant pricing for ferrying patients. Delhi government has assured to take strict action against those who are profiting during this particular crisis. India Today in its report, remember, had shown how some drivers were charging close to about 1,000 rupees per kilometer in their ICU ventilator ambulance. Corona has created a horrendous situation in Uttar Pradesh, and Prime Minister Modi's constituency, Varanasi, is one amongst the worst impacted by COVID. Families of COVID patients in Varanasi, which is the Prime Minister's constituency, are alleging total mismanagement. Here's a ground report coming in from Varanasi.
It's a constant fight against the pandemic, a fight to get a bed, a fight to get oxygen, and a fight to get even basic medicines. But even after one passes all these hurdles, a new struggle has been added. In Prime Minister Modi's constituency, Varanasi, the families of COVID patients allege that Banaras Hindu University's Sir Sundar Lal Hospital is not treating their relatives properly.
तो डॉक्टर हमने अभी एक विजिट कंपाउंडर और वार्ड बॉय ही देख रहे हैं, ये क्या करेंगे ट्रीटमेंट? इनको तो जो इंस्ट्रक्ट किया जाएगा भाई, और इवन ये भी दवाई नहीं रह रहा, तो ये नहीं बता रहे कि आपके पास ये दवाई नहीं.
Meet Ram Prakash, who has brought his wife all the way from Gazipur to Varanasi. His wife has been in coma for the past 5 days. No medication has been administered after dialysis, he claims.
नहीं, हमें उम्मीद नहीं थी ऐसा होगा, लेकिन बहुत बुरा हो रहा है सर. ये मरीज मारे जा रहे हैं, डॉक्टर साहब मिल नहीं रहे हैं कि उनसे मिलके अपने दुख को बताया जाए कि ये दशा है.
It is well known and crucial that PPE kits need to be disposed of properly, or else they pose a huge hazard. But what India Today's team found was that used PPE kits are being thrown inside hospital premises, potentially exposing hundreds to the deadly virus.
यहीं पर लोग आ रहे हैं और यहीं पे PPE किट उतार के फेंक रहे हैं, देख सकते हैं. ये हो सकता है अस्पताल के कर्मचारी हों या फिर किसी मरीज के तीमारदार हों, और भी तमाम शिकायतें हैं लोगों की. इस तरह की लापरवाही के आरोप लग रहे हैं कि यहाँ पर इलाज नहीं हो रहा है.
COVID has already created a dire situation in Uttar Pradesh. And Varanasi hasn't dodged the crisis. The holy city has recorded 1,116 cases with 18 deaths in the last 24 hours. This VVIP constituency, the Prime Minister's own, is reeling under the impact of COVID. And beyond that, the government's handling of COVID is also possibly impacting the outcome on political battlegrounds. A case in point is the Panchayat elections. After 4 years in the political wilderness, the Samajwadi Party seems to be on a comeback trail. The SP is seen either winning or leading in 747 Panchayat wards that include Ayodhya, Mathura, Prayagraj, and the Prime Minister's own constituency of Varanasi. While the ruling BJP stands decimated in its Hindutva bastions. This report filed by Roshan Jaiswal in Varanasi for India Today.
That's a